Well, I mean, a big factor is pain, obviously, but a lot of people do injure their finger or their wrist and it feels a little bit sore and they think, oh, it'll get better after a couple of days, and they just kind of get on with it. But the main factor is if it's affecting your function. So if you're finding that you're avoiding doing certain tasks, you're holding things in a different way, you're overcompensating with other parts of your hand, or you're avoiding certain activities that trigger that pain, even within a 24-hour period, that's definitely a sign that you should get someone to have a look at it, whether it's a doctor, a therapist, surgeon, whoever you can access the soonest. So we are constantly using our lower limbs. We're walking on them. We're loading through our legs and our ankles and our feet. We don't do that with our hands anymore, but we still do use our upper limbs for pretty much everything else in our lives, from feeding ourselves to dressing to working to caring for others. And we also need quite a lot of precision with our fingers, especially. So some modalities that apply to the lower limb, such as resting it for a certain period of time, we only want to rest the structures that are affected or injured. So if it is a singular finger, for example, we want to protect that, but make sure that we're using the rest of the hand for those precision activities and tasks to make sure we don't lose, we lose as little function as possible while we're waiting for that structure to recover before we then start to get it moving. So previously with lower limb injuries, people used to offload that for quite a long time and be on crutches for much longer, whereas now physios emphasize the importance of getting back into loading the leg. So walking, putting weight on that leg with a moon boot on, for example. So in that sense, similar strategies do apply to the upper limb. We want to protect only the joints or the structures that were affected, but make sure that we're using the rest of it as much as possible. What research has found over the last couple of decades is after a period of 4 to 6 weeks of immobilization for a upper limb, for a wrist fracture, for example, we can lose up to 10% bone density and around 40% of muscle strength for grip strength as well. So a lot of the approaches that we apply to treating injuries is immobilization and protection while still trying to maintain function so that our recovery takes as little time as possible and structures heal as quickly as possible. Some people refer to it as a compensation cascade. When that happens, let's use an example of a thumb injury. You've pulled a ligament in your thumb. You are now trying to rest the thumb as much as you can because it hurts to grasp things. So you start grabbing things just with your fingers without using your thumb, or worse still, you're holding bags and you start holding the handle with just a couple of fingers like so, while keeping the thumb excluded. We're then using muscles for jobs for tasks that they weren't designed for, in a sense. We then start to get overuse injuries, repetitive strain injuries to the smaller muscles of the hand, which then affects how we pick things up. So then we might start using more of our shoulder to actually lift things as opposed to the muscles of your forearm to lift your wrist. Your shoulder then gets really tight because you're shrugging too much. You then get a tight neck muscles from overcompensating with the shoulder. Then you start to get migraines. That's an extreme scenario, but things that are left for several months that aren't addressed or assessed by a therapist or a medical practitioner can develop into things like that, which then can take much longer to undo those compensatory motor patterns while still also trying to recover the originally injured structure. Well, the way patients present to us is they might have had an injury that has taken longer than a couple of weeks to go away, so they want to get someone to have a look at it. So they'll look us up online and they'll see a therapist who will say, well, it seems like X, Y, and Z is happening. We should get some scans, write a letter to their doctor to then provide them a referral to get scans. We then have to wait for the results of that or be able to view it ourselves before then having to write back to the doctor to ask for a referral to a specialist like a hand plastic surgeon or orthopedic surgeon. And that in itself can take several weeks to happen. And sometimes patients can come to us after being referred by a doctor. Other times it's just word of mouth referral. But the amount of time and the effort that it takes to complete all those those different steps can also be a deterrent to patients getting something checked out properly. So they might just default to, I'll just wait and see a little bit longer, or I'll just, stop doing this certain activity for a little bit longer, when they might not necessarily have to, or it might not help them whatsoever, and it just prolongs their recovery. It's quite a long process. Sometimes there are also injuries where if they are addressed immediately or within a week or so, it prevents the need for much more invasive treatment. So going from, let's say, a hairline fracture in someone's little finger, again, I'm going to use that example, it was a little bit sore and they didn't do much about it. They kept on playing sport. They then got that finger caught in someone's jersey a week or two later, and that small fracture turned into a very large break that has displaced the two bone fragments, which then has required surgery. And by that point, it's been a couple of weeks. The bone has already started to heal in a malunion, so in an incorrect position. So they either have to deal with ongoing deformities and limitations to their function, or surgery needs to be undertaken to correct that deformity, which sometimes requires re-breaking the bone and a lot more effort on the surgeon's behalf, but also a lot more pain and discomfort and rehab on the patient's side as well. So with the RATP, people can get seen to a lot sooner. So that whole process goes from several weeks to just a few days. They get access to a surgeon who can provide referrals for imaging if required. They can then provide that opinion within, I think it's 24 hours. And following that, if they do need surgery, they are immediately booked in or shown the appropriate pathway, or conservative treatment, which most often is the more appropriate pathway to an injury like a broken finger that hasn't been displaced, or a torn ligament that's not a complete rupture. They are then seen to by a therapist within a week, protected, and put on the appropriate pathway much sooner than required. And usually within that period of time, it hasn't been enough time to develop those compensatory motor patterns. They haven't developed any kind of chronic pain conditions. We prevent a lot of long-term complications just by being seen sooner.